So uh, OCEAN, it means optimizing our community health program for hypertension control in Bethenjuk and Pascal municipalities of Nepal. And Dulkil Hospital has a collaborating partner as a Dickinson University and Medic as a supporting partner for the implementation of the community health toolkit. Um, the goal of this project, with the reference to the community health toolkit in rural Nepal by empowering frontline health workers and female community health volunteers. And the study site we choose as a Pascal, that is the urban municipality health facilities, and Betanchuk rural municipality health facilities. The users are female community health volunteers, which the 28 FCSBs has been using this community health toolkit to screen the hypertension cases. And the frontline health workers are health assistant and auxiliary nurse midwives from 9 health facilities from these 2 study sites. And in total, 22 frontline health workers are using the community health toolkit as of now. So, how is the hierarchy and the user roles are defined for this implementation? Is at the top there is admin as a program officer who can see the dashboard and make the changes. And then, if you can see the red one in the bottom, they are the individuals. And if you see the again the red one on the last row, the second last row, these are the household. And the FCSBs, if you can see the FCSBs, they are the community health worker who include the households in the community health toolkit kit and the individuals. And then the FCSB are taking the blood pressure, screening the hypertensive patients, and they will be tagging to the frontline health workers in the health facility. If you can see the health facility icons, so the hierarchy is like on the bottom. The FCSB includes the household individuals. Then, if they are found high blood pressure, then they will be tagging to the health facility. So this is how the hierarchy and user roles are defined for this project. The initial findings that we have found till date is there are 294 people above 40 years screened for increased blood pressure by 28 FCSBs. That is, each FCSB has averaged 11 screened the participants. And then 22 frontline health workers have been using the CHT to provide services to 176 people. And then among them, like 51 new case detection are at the health facilities with hypertension, and 93 hypertensive patients are also received awareness messages by this CHT. So my friend Ashtray will be showing a demo of the CST, how the FCSB and the FLSW, Frontline Health Worker Terminal, works for 5 to 7 minutes. Over to you, Ashtray. Then I will come to the challenges that we have faced, and then what we have requested for the changes that we required further to have a very good interface also, and to work efficiently. Ashraf, over to you.
Thank you, Dr. Rajni. Hello, everyone. My name is Ashraya, and I work as Research Project Coordinator in Dulkhela Hospital, Kathmandu University Hospital. So let me start by sharing my screen. So this is the FCHV terminal, how it looks like. when we go to the login part, and then after I enter the login details, this is how the dashboard, or what we call the screen, looks like. And when the FCHV, she needs to enter a new patient or needs to register a new patient, she will go to this plus button here, and then she'll click new household. Yeah. After that, she will be creating a new person by clicking here, and then she'll be entering a name. For example, maybe, yeah. So she'll enter the age, 40 years for now, and the phone number, alternate phone number if the patient has, and the relation to household head. Yeah, so this is the address. Yeah, this is how a household is created by the FCHV. And after creating a household and registering a household, she will go and click this person's name whom she is about to enter the data, whom she is about to screen. So again, after clicking the person's name, she'll be clicking the blue button, and then she'll be filling the screening form. Yeah, the question appears like this. Are you taking, yeah. She'll be filling these questions. Do you have urgency to pass hearing? Yeah. Okay. Yeah. After that, she'll be entering her, after measuring the blood pressure, she'll be entering here in this app. First, right hand and left hand reading. She'll be entering here. Yeah, and then if the blood pressure is found to be 140 by 90 mmHg, she'll be asking the patient to go and visit the nearby health facility. And after that, she'll be clicking, she'll be entering these details. She'll be giving health education to the patient regarding nutrition, exercises, smoking, and then she'll be submitting the form. So like this, the screening form is entered by the FCHV, and she'll be syncing here. So after she has entered the details of the screening form, after she has said the patient to go and visit the nearby health facility. So now the patient will go and visit the nearby health facility, and now I'll be logging in from the health facility's username. Yeah, so this is the FLHW, that is the Frontline Health Workers Terminal. It appears like this. So when we go to the reports, this is whose form I've just entered now. Yeah, the details we can see here. The health worker, now he can see the details of the patient that the FCHVs had entered and asked them to visit the health facility. Now, after the patient, after she has visited the health facility, now the frontline health worker, he will be filling action form. So, yeah. So he'll be entering the details. And after taking her blood pressure measurement, he'll be entering in the app. So these are the health education messages that the health worker sees on his screen. These are certain, what we can call it as flash messages on what will he call as a suspected case of hypertension. So these are the definitions of that. He will also be given counseling. So like this, he will be filling the action form of the patient who was referred by the FCHVs to go to the health post. So like this, the FCHV first she goes to the household. After that, she enters the details of the after she screens the patients above 40 years of that household, and whosoever BP if found 140/90, after she enters in the app, she will refer it to the health post, and the health post health worker, he will go to his ID, and then he will extract the data. He'll go to that person, he'll pick that person, and he'll enter his action form. So this is how the app is. um, yeah, so yeah, this is how the app is.
Okay. Despite it went very well in the community, the FCSBs, they grasped the digitalization education very well. There were some technical challenges and implementation challenges. Just like during deployment, we tried to let's encrypt SSL in subdomain, but it was failed and needed to wait for 72 hours long, and we have to try again for SSL subdomain. Therefore, our technical team, we have Sandeep and Sanjeet over here, they created another subdomain and implemented the SSL. So this was the technical challenge. At the same time, there was some implementation challenges as well, just like during the piloting when we were giving training to the FCSBs, this application was not supported below the Android version 9. And then in the remote areas, there are some connectivity issues. Even though the FCSBs enter every data, they could not sync the data at the same day or something like that when there is connectivity issue. And some FCSBs, they dropped this training because they were illiterate and they could not go ahead with this application. And at the point of healthcare providers, they do have to enter these data in the paper-based records as well as in this application. So it seems like the workload, so they were saying if would be good if we can do only in the digital form. And we do have a Nepali font, the Nepali font calendar was not supported. That is the like Hamro Patro we have in Bikram Sambat. We don't use the AD, but we do use the BS system that is only in the only Nepali calendar that we have. People are very used to use the Nepali calendar, so it was also one of the challenges we faced during the implementation. And on the back end, when we extract the data from the back end, though in the user interface the ease was mandatory, some of the data were missing in the database. So these are the challenges. So what we did is this is feedback and the feature request for the developers. In the frontline health worker interface, it would be great if there will be the push notification in mobile of the frontline health workers regarding the due visits of the patients, like the patients who have the due visits, who don't have come to the health facilities, or those patients who does have to visit the health facilities regularly. And if that would be great, if the FLSW get the push notification, and the saving function in the midway of the form field, just like in hypertension cases, if the patient has just took the caffeinated drink, or sometimes if the bladder is not empty, then the blood pressure get varies. That's why, just like the if the form is saved, can be saved in the midway, even after like feeding the general info, that would be great. And then next is scheduled automatic messaging system for the patients. For this ocean study, we have to we did the patient awareness messaging system manually, but it would be great if the system can send the message. And next is for the dashboard, for the frontline health workers, it would be great if there is a graphical visualization of the integrated data, just like how many has been come in the health post, and how many has blood pressure, high blood pressure, or how many has blood pressure along with the comorbidities or something like that. And also personalized data graph, if we can see the every visit blood pressure and something like that, that would be very easy for the health workers to see the data at a glance. And it would be also another great, I think, if we can add library regarding specific diseases topics along with the auto update, just like in the back end, if we did any updates regarding the recent evidences regarding any of the diseases, not only the hypertension, then it would be great if we can add the library and auto update system for the evidence of any of the diseases.
Thank you, Dr. Rajni, and thank you, Ashray. So at this point, I will just let any of the participants over here have any questions, comment, feedback to Dr. Rajni and Ashray on the presentation, and maybe we'll look into like some of the feedback specifically. So please feel free to unmute yourself or type in the chat box as well if you have any questions or any feedback.
Thanks for that great presentation. That was really interesting. I had one question just about the devices that they are using. So you'd mentioned that the FCHVs, there was something about Android 9. So I assume they're using mobile phones for that. Is that correct?
Yeah, they are using mobile phones, their own individual phones. Yeah.
Okay. And the FLHWs, are they on a computer, or are they also using the phones?
Their phones.
Okay, so everything's on the phone.
Yeah.
Okay, cool. I just wasn't sure because in the demo we were showing the like the full screen version. Thank you. And are they just thinking about these, like the notifications and all that kind of stuff? They are typically working offline also, right?
Yeah.
Okay.
Yes, they are working offline. And they do need internet only when they need to sync the data.
Mm-hmm. Okay. And they, roughly how often are they doing the syncing?
It's usually daily they do the syncing, or sometimes even after entering the data for one client or the patient. But it is sometimes harder for the FCSVs who live in rural areas.
Gotcha. Cool. Thanks for that.
Yeah, thank you very much. I just have a question from my end regarding our CHT that have been supported. Thank you very much, actually supporting our team for developing this tool, and it has really been very useful. What I wanted to add to this as the challenges is that when we wanted to send the messages, we actually wanted to send the voice messages, and then later we came to know that it was a bit difficult to send this voice messages. That's why we opted then for the text messages to be sent. That is one thing. The second thing is the electronic decision support system for the frontline health workers as well as for the FCSVs, so that it can guide itself towards the patient management. I think that is still a challenge because We are also working on the FLSW and on other project, but then we see it as a challenge of having this electronic decision support system on patient management. So I think it would be a good idea to discuss further on how to improve this or how to add this system or tool to what we are doing so that it can be more useful for those who are using it, like from the end of female community health volunteers as well as from the end of frontline health workers. So this is something that I wanted to add. Thank you very much.
Thank you very much, Dr. Ava. Right. I will just take notes of these requests and then we'll talk about this later, Dr. Ava, on these on upcoming meetings.
I think on automated messaging system for patients, that's something that's already supported, and CHT has been able to integrate with other systems just to support that, like Rapid Pro. And I think I saw Hanok on the call. I'm not sure. They have been doing the same project in Malawi, but it's a conversation we can continue. Hanok, would you like to take a minute just to share how you are using CHT to support that?
Yeah, I don't know if I'm audible enough.
Yes, can hear you. Thanks.
Yeah, so we're using CHT, which is integrated with Rapid Pro in 2 projects. In Malawi, we are using it to send messages to people living with HIV who are receiving antiviral therapy. We send these messages, blast messages, weekly. We have a cohort of around 800 patients who are receiving message from the two-way texting. We also included tailored visit reminders. So 3 days before the appointment, we are reminding the patients to go to the clinic to pick up antiviral therapy. And there is an interaction where a patient would indicate whether they'll go for that scheduled appointment or not. We also allow them to reschedule the appointment through that structured interaction with the two-way texting system. The other project, it's on male circumcision. We are implementing it in Zimbabwe and South Africa. So the two-way texting is used to provide post-operative care. So after circumcision, we give option to circumcised individuals, whether they want to come to the facility for review or just receive messages and only come if they are experiencing some adverse events. So we send messages to them from day 1 to day 14, and also they respond if they are fine, or if they have some problems, they also reply through the two-way texting platform. In brief, that's what I can share at the moment. I'll post some of our publication from this work in the chat. Thank you.
All right. Thank you, Dr. Hanok. And just to make sure we are able to wrap up this session, for the function of saving for Midway, I think that's something that you already have on the forum. We can be able to follow that up with the team and also collaborate with the product team and explore if that might be possible. But thanks for that. So I've just posted here a link for that conversation where you can be able to stop and save a form in between and come later and complete that. So you can go through the forum posts, and if you need more clarification, you can be able to reach out. Thank you.